is a short demonstration video to guide you in the use of a medical bed. So one thing to think about when you get an adjustable bed is where you put it in the room. If you're able to, you want to give it as much room up against, farther away from the walls that you can. This allows you to get on all sides of the bed, including the head of the bed, to adjust somebody to be in the right position. Somebody laying in a bed, you want their head to be at the pillows, so that if you adjust the top, that it's properly aligned. And a bed can be adjusted in many different ways. One way is the height of the bed. In this case, the buttons are at the foot of the bed, and it can be brought up or down. Adjusting the bed up or down can help somebody if they're sitting edge of bed so that they have maybe more height so they don't have to stand up as much, or if you need to lower it further down to maybe align with a wheelchair height. You can also adjust a bed to the head of the bed to raise or lower. In this case, the buttons are at the bed rail. Bringing the head of the bed up, you can bring it up usually kind of high, and that helps a person sit up more in bed rather than laying completely flat. For adjustable beds, you can typically adjust the bed rails so that they're up or down. For this one, you just have to swing them up and make sure that they're locked in place. You always want to make sure they're locked so that when a person's in bed, that this doesn't come down. For this bed, there's a push button to push to bring the bed rail back down. Again, every bed is going to be different. So I would take some time to adjust a bed and kind of see how everything works before you use it. Also, some beds, how these buttons are on the bed rails or the foot of the bed, some beds just have a remote so that the person laying in bed can adjust everything that they would like. This video is not all-encompassing, so if you have any questions, please ask your physician.